Hi, this is your Endless Nurses World channel. Today we are going to see about renal and urinary system. The question number 1. A client with acute kidney injury has a serum potassium level of 7 milliequivalent per liter. It means 7 millimole per liter. So the patient is having hyperkalemia. The nurse should plan which actions as a priority. Select all that apply. So even the hyperkalemia is an emergency condition in which the patients will develop cardiac dysrhythmias and cardiac arrest. So we have to place the client on a cardiac monitor, notify the healthcare provider and review the client's medications to determine whether it is contained or retained potassium. And putting the client NPO, it is not an indication for hyperkalemia. So the answer is place the client on a cardiac monitor, notify the healthcare provider, review the client's medications to determine if any contain or retain potassium. A client being hemodialyzed suddenly becomes short of breath and complains of chest pain. The patient is and during dialysis the patient is having chest pain, shortness of breath. So the client is tachycardia, pale and anxious, and the nurse suspects ear embolism. What are the priority nursing actions? Select all that apply. So during dialysis the patient is having embolus formation. First we have to stop the dialysis. Stop dialysis and turn the client on the left side with the head lower than feet. Because of this position, the clot will be retained in the right side of the heart. Then administer the oxygen to the client, notify the healthcare provider and rapid response team. And continue dialysis, it is not advisable, and the bolus clearness, it is not advisable. So the answer is administer oxygen to the client, notify the healthcare provider and rapid response team, and stop dialysis and turn the client on the left side with the head lower than feet. Next question is, a client arrives at the emergency department which complains of lower abdominal pain and hematuria. The client is a febrile. The nurse next assesses the client to determine the history of which condition. So the patient is having lower abdominal pain, hematuria and fever. So these conditions is associated with the patient is having trauma to the bladder or abdomen. So in pyelonephritis and glomerulonephritis, the patient is having the fever but it is not applicable. And renal cancer, if the patient is having pain in the lower abdomen or in the flank area. So the hematuria, lower abdominal pain and fever indicates the patient is having trauma to the bladder or abdomen. This is the answer. The next is, the nurse discuss plans for future treatment options with the client with the symptomatic polycystic kidney disease. Which treatment should be included in this discussion? Select all that apply. Polycystic kidney disease, it is a genetic familial disease in which the kidneys having size will be enlarged and this with cyst that ruptured kidneys become scar. So eventually the resulting in the end stage renal disease. So end stage renal disease, we have to advise the patients for dialysis, hemodialysis, kidney transplant and bilateral nephrectomy. And peritoneal dialysis and intense immunosuppression therapy, it is not an indication. So the answer is, when the patient is having polycystic kidney disease, see the answer is hemodialysis, kidney transplant and bilateral nephrectomy. A client is admitted to the emergency department following a fall from a horse and the healthcare provider prescribes insertion of urine catheter. While preparing for the procedure, the nurse notes blood at the urinary meatus. The nurse should take which action? So the patient is having the blood at the urinary meatus. So we have to notify the healthcare provider before performing the catheterization. So it is the priorities. And use a small sized catheter and an anesthetic gel as a lubricant. Administer parenteral pain medications and clean the meatus with soap and water. It is not indicated. So we have to, the answer is notify the healthcare provider before performing the catheterization to rule out the where the hemorrhage is happening. The nurse is assessing the patency of the client's left arm arteriovenous fistula prior to initiating hemodialysis, which finding indicates that the fistula is patent. So, the patient is having fistula. While palpating, we have to feel the thrill sound. During auscultation, we have to feel the bruise sound. So, and the next, presence of radial pulse in the left wrist and capillary refill less than 3 seconds, it indicates the circulation of the hand. And visualization, it is a normal observations of the fistula. So before performing the dialysis, we have to monitor the patency of the AV fistula. While palpating, we have to feel a thrill sound, and while auscultating, we have to feel a bruise sound. This is the answer. A male client has a tentative diagnosis of urethritis. The nurse should assess the client for which manifestation of the disorder. So if the patient is having urethritis, so the urethritis, it is the chlamydial infection. It is characterized by dysuria and accompanied by mucopurulent, clear to mucopurulent discharge. So the hematuria and proteinuria, it is not indicated, and dysuria and penile discharge is a clinical manifestation of urethritis. The nurse is assessing a client with the epididymitis. The nurse anticipates which findings on physical examination. So epididymitis, it is includes scrotal pain, swelling, and systemic symptoms are fever, nausea, vomiting, and chills. So it is due to infections, although sometimes it is caused by the trauma. So the epididymitis, the answer is fever, nausea, vomiting, and painful scrotal edema. A client complains of fever, perineal pain, and urinary urgency, frequency, dysuria. To assess whether the client problem is related to bacterial prostatitis, the nurse reviews the results of the prostate examination for which prostate, so characteristics of this disorder. So in bacterial prostatitis, so the nurse, we have to examine the prostate gland will become tender, indurated prostate gland, and it is warm to touch. Associated with other systematic symptoms like fever, chills, perineal, and low back pain, and it is associated with the symptoms of UTI also. So the answer is tender, indurated prostate gland, and that is warm to touch. The nurse is collecting data from a client. Which symptom described by the client is characteristics of an early symptom of benign prostatic hyperplasia? Nocturia, scrotal edema, occasional constipation. The decreased force in the stream of urine. This is the answer. So the decreased force in the stream of urine, it is an early symptom of benign prostatic hyperplasia, and it is followed become weak and dribbling, and it may be develop hematuria, frequency, urgency, urge incontinence, and nocturia, and later on complete obstruction and urinary retention will occur. So this is the answer. Thank you. These are all about renal and urinary questions. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.